Thank you. Back again, Rumbi again, Associate Editor at Devex. And speaking of innovation, our next conversation really talks a lot about innovation. We're going to be discussing digital health. I'd like you to welcome on stage our speakers, Ruchit Nagar, who's the CEO and co-founder of Khushi Baby, and Ramatu Yorpoi, who's a community health worker with Partners in Health. Ruchit, I want us to kick off the conversation with you. I think your company, Khushi Baby, is such an example of how companies can evolve to meet the needs of countries and communities. You started off with a focus on a product and then moved to a focus on a system. Can you take us through that transition and evolution of Khushi Baby?
Yeah, so for those who don't know, Khushi means happiness in Hindi. And initially, we wanted to have happy and healthy babies. And we had developed a solution that was focused on child immunization for under-resourced settings, working with a local NGO, generating evidence, doing randomized trials to see if our digital health application could actually be useful for the community health worker, as well as improve immunization outcomes. And after 3 years of gathering evidence that was promising, we went to the state government and we looked to see if we could scale up this focus solution across the state of Rajasthan, which is India's largest state by area. And that's when the health secretary told us that, well, you're looking at one problem, but actually I have 40 different digital health systems, and these community health workers are working on 12 different programs. We need to figure out how to fix the plumbing of the public health system. And that became our kind of refined vision and changed our approach to not just thinking about immunization or maternal and child health, but really thinking about the whole scale of the problem and how the community health worker needed to be centered around that problem. COVID became a pivotal moment for us because it allowed us to actually test whether we could translate our learnings from one healthcare domain into screening at a much larger scale for multiple primary healthcare issues. And through that learning, we were then able to go to different health programs one at a time. Now that we had built a base of the population that was screened through this platform, and say that, okay, now we have helped screen 14 million people across the state. Does the TB department want to start to leverage this? Does the vector-borne disease department want to start to leverage this? And they began to piggyback off that existing base that was built. But none of this would have been possible without having the ability to evolve, and the evolution requires you to be on the ground. It requires you to work with the communities directly. And since our beginning, we've had 15 members on our team, field monitors, that work side by side with the community health workers every day, and allows us to kind of iterate on the product, on the solution, but also make sure that that solution is, where is it working for them, where is it not working for them? And we still have a long ways to go.
Thank you so much. I think that raises such an important point. I think you say it's the health ministry, say there's 40 different apps that people are working on. And one of our journalists actually had the opportunity to go into the field with you and speak to some community health workers. And one of the issues that they raised is that they have this wonderful app that's helping them. They're able to keep track of like immunizations. They're able to get warnings when it's now time for a child to get an immunization, when they've missed an immunization. This is all wonderful, but they're still required to manually record this information, and they're also required to work on a range of other different apps, and it's not just one app. So I want to come to you, Ramatu. What has your experience been working with digital health solutions, and what would you like the companies and maybe the governments to understand as a community health worker?
Yeah, thank you very much. First of all, I appreciate for me being here today. Digital help us a lot because first of all, it helps us to ease our job, and it helps us manage patient information, confidentiality. We refer patients through digital without spending money by transportation. We raise awareness with digital without facing the road network, which is very bad in the part of my area. And it also helps us to make sure that we refer patients from the facility to the community health worker that is staying in that community that patient is belong. So it has a lot of impact in CHW's work. It helped us a lot. It reduced stigma in the community. Before we use papers and pen, any household we approach, everybody want to know what we are doing, and sometimes we deal with patients that have a stigma with their status. So the neighborhood will just come around looking into the papers. So now when we're using the digital tools, you will just be discussing with your patient while you are doing the entering without anyone noticing what you are doing. So what I have to say here today, digital is very important for community health use. And if we want the world to be a better place to live, we need to invest in community health workers. And with digital is Nike. Thank you.
That's you can keep that one. That's such a great endorsement for digital health, and you must be really happy to hear that, Ruchit. But I want to go back with you. Like, your program has got field workers who are working hand in hand with community health workers, and you've sort of made an effort to put community health workers at the center of the solution. Why is that so important, and what lessons can other companies take from this?
Yeah, that's a important question. Right now, we have to both design for the community health worker, but at the same time satisfy the requirement of the government guidelines and the decision makers who are working at the state and central governments. And if you look across all these different health programs in India, there are some 800 public health indicators across these 12 plus different programs that community health workers have to keep track of. They have to submit, reports at the end of the month on 50 activities that they're in order to get paid, and that takes them over 50 hours a month of just paperwork. So we have to design for a multi-stakeholder environment, and oftentimes the policymakers and even the other agencies that maybe focus on a specific health vertical, they are not going to the field to understand how multiple vertical solutions are causing a burden on the community health worker, and how, as a result of that, the data quality is suffering, and the data that's being reported, because the quality suffers, is not as useful to actually feed back to the community and improve the conditions on the ground. So what is needed, I think, is to have both that tree level view and forest level view, and better coordination and collaboration, both with policymakers, with development agencies, and having community health workers have a seat at the table. So that way, the system that is ultimately designed, that plumbing, is something that is rational for the person that will have to take the burden of it forward, and something that can actually enable her to use that system to its full potential. As we just heard, the digital health tools can be enabling. They have tremendous potential to make impact, but that impact can only be unlocked if they don't also have to work on paper, if the data is integrated, and if they're properly incentivized based off the work that they're reporting, so that way, ultimately, that data can feed back to improve the communities. They are ultimately the public health researchers. They are the eyes and ears of the community. So the reports that they send need to have some value, and there needs to be some rationalization around it.
Thank you so much. Ramatu, Ruchit actually just broke down like some of the things that companies and governments also need to consider. And you gave digital health like a seal of approval. But is there anything that digital health companies can do to make your work easier?
Yeah, thank you again. I have just stated some like it helps a lot, because even by tracking the patient, because some of our patients will go lost to follow up, we use digital tools to track them by not going to the community, start asking door to door. You trace the patient through the system, and you find the name, the community, the location. You go straight there and track the patient and get the information you need. So it's very, very important. And it helps people to have the confidence to work with us, believing that their their secret is being safe with us, as we are the trusted messengers. I think with digitals, we can do it more better.
I'll just add on that. I think so. Where we work in India right now, there are still 5 or 10 years ago, it was 10 registers, and now it's 10 apps plus 10 registers. So I don't know if we've made progress, but our solution that we are trying to implement on the ground is supposed to be integrated. So you register the person, you do a census of your village, you register each family, and then you can longitudinally follow up each person, no matter what program they fall in. And what community health workers have told us is useful for them, even though they have a double or triple burden, is that they can actually see all the houses that they need to visit today, this week, this month, according to the different programs. It helps them organize and pre-plan their activities. It has decision support built in, and it can have the potential to automate some of their work. So that's where we're trying to really unlock that value, but we will definitely need support from the policymakers and other development partners.
And final question, do policymakers get a sense of this increased burden as well? Do they understand that? And what are sort of the next steps? Are there any steps in India, like to decrease that burden? I know you said you moved from 10 manual registers to 10 manual registers plus apps. That sounds excessive.
Yeah, no, I think we're having this interesting transition period right now, and we should avoid the perils of over documentation, which developed countries have fallen into. But some of the exciting initiatives, I would say, is the government of India is trying to streamline how apps talk to each other through a common language or through a common framework. And we believe that this will actually allow for interoperability between systems to make it easier to connect pre-existing systems with new systems as well. And also what's good about that framework is that it keeps the patient in the center. So having a patient-driven, consent-driven process to how records are being shared. So these are some exciting developments India's National Digital Health Mission is trying to implement in order to solve some of these well-entrenched problems.
Thank you so much to both of you for joining me. We'll definitely be on the lookout for some of these innovations.
Thank you.